when patients come in with their first diagnosis of breast cancer, it can often be from a lump that's found by the patient, and also from a mammogram, which is, I've found, is very good for my patients who have come in. There's a lot of thought alternatively about mammograms not being good, but I've had at least 2 or 3 patients who have been picked up at a very, very small, with a very, very small tumor that wouldn't have been detectable by palpation or by pushing on it. And that's basically saved their lives. Getting on a cancer early is the key to getting anybody better fast. And the earlier the better. If that mammogram wasn't done and they had come in 2 years later or 3 years later, and it had moved to the liver or it moved to the bone, then that's a really, really tough situation to handle. So the early diagnosis is the key to success and prevention. So there are families who have a large number of cancers in it. It's just, there are certain, we call them syndromes, where there are genes that are there that just have a number of cancer patients, whether it's colon cancer, uterine cancer is part of that whole syndrome of genes. And if that's the case, then we got to find out the family members and then get them treated for prevention. And that's where naturopathic medicine comes in and can do a dynamite job without side effects, is also in the prevention of cancers. Another one is colon cancer, which has a couple of markers that say whether it's going to be more severe or not. And if those markers are present, the rest of the family should be checked for those as well. And then we can do some prevention to make sure that no cancer actually forms or helps with that kind of prevention. And that's the best place to start for any cancer. That's not that often that we start at that place. I'd say percentage-wise, maybe 2 or 3% at the most, is a patient who comes in and says, you know what, I just want to prevent a cancer that might be coming. What can you do? And one of the things we can do is an early screening test that's called IVGene, which screens 2 common cancer genes that are there and can promote cancer, tell the presence of cancer in the body. So patients will use this for if there's been a mastectomy, and patients want to say, okay, is there any cancer that's remaining? This is even more sensitive than a CT scan. It's a very sensitive test that we do as a blood test to say, is there anything here at all? We use that test quite a bit, and it's only available through naturopathic physicians who work with cancer. So that's something we use quite a bit.